everyone. I'm Preeti. I'm the registered migration agent in Aussizz Birth's office. And today we are talking about the health occupations and the niche skills assessment for those ones, and what leads to the residency, what are their requirements, what are their skills assessment bodies, and particularly right now, as we all know, health occupations are currently good in demand, and they all are leading to the residency as long as we meet the requirements, either by doing an accredited courses of those ones or by having some experience which is required by the assessment body. I would be covering the popular destinations for the health occupations, which is basically few of them are like medical laboratory scientists, registered nurses with several specializations, enrolled nurses, general practitioners, pharmacists, pharmacy technicians, and all of those ones, and something like, the occupational therapist and psychologist. So, first, I will talk about the medical laboratory scientist. This occupation is in a long term list. The assessment body is AIMS. And then we again have got a similar occupation of a medical laboratory technician. This occupation is also assessed by AIM, but is in a short term list. So basically, the main reason for having an occupation in a long term list is that you do not need a state nomination to give you the invitation to apply for the visa. However, if it's in a long term list, you can directly apply for a 189 visa where you do not need any invitation from the state. All the states mostly have got all the health occupations. So even if it's in a short term list, we should not be worrying a lot about it, because every state is readily giving the invitations at the lower points for medical laboratory, like, for example, medical laboratory technician, which is in a short term list. Then we have got a medical technicians NEC. Now, this one is the different assessment body, which is called a wet assess, and they need their requirements completely get different. So, as I will cover the requirements of a skills assessment body, I will talk about that. What does the AIMS need for the skills assessment, and what will be the requirement for a wet assess? People do get confused a lot when we talk about a medical laboratory technician and we talk about a medical technician's NEC. So it is completely different occupation, completely different requirement of the skills assessment body. And as I will go through the assessment requirements, I'll be talking about it. Then the next one I'll talk about is a hospital pharmacist, retail pharmacist, industrial pharmacist, and pharmacy technician. Now, hospital pharmacists and retail pharmacists, they both are assessed by a pharmacy, and they all are in the short-term list. It's a registered profession. You would need the registration for both of these ones. However, when we talk about industrial and pharmacy technician, they are assessed by wet assess, and their requirement is different. So if even these are not the registered professions, if you have an experience, you can go ahead with those ones, and we will talk about it once we cover. Then I would be talking about let's come up to the psychologist. There are three types, where it is psychologists NEC, a clinical psychologist, and organizational psychologist. So these all three are assessed by APS, and they all are in the long-term list. So for this one, the requirement for all of these three occupations is almost very similar. Then I would also be talking about occupational therapist, which is this assessment body is the OTC. They are a long-term occupation list. Physiotherapists, speech pathologists, they are done by APS and SPA, and then biotechnologists and macrobiologists, they are done by wet assess. So these occupations are completely all about when we have done the studies. In these all of these occupations, your highly relevant study is very important. You can only get the skills assessment if you have studied in that field. If you haven't studied, we cannot. And then some would need an experience, some will not. And I talk about that. Let's say, for example, we're talking about a registered nurse. Your assessment body is going to be ANMAC, ANMAC. And that is the Nursing and Midwifery Accreditation Council. And they assess for the registered nurses as well as for your midwifery. Then we have got AIMS, that's for the medical laboratory scientist. Then we have got a VETSS, that is responsible for the pharmacy, medical technicians, industrial pharmacists, microbiologists, and all of those ones. Then we talk about the Pharmacy Council, that is APC, that is for the registered profession of the pharmacists, like um, pharmacy technician as well. Sorry.